Today is Friday, May 1st. This is VOA's International Edition. I'm Lori London in Washington. Coming up, bleak new figures underscore the worldwide economic pain inflicted by the coronavirus.
Another 3.8 million Americans filed new claims for unemployment benefits last week. That alone would be shockingly high under any circumstances.
An extraordinary diplomatic dispute intensifying between Australia and China over the new coronavirus. Also, ahead of World Press Freedom Day Sunday, the pandemic is highlighting the need for journalists who are on the front lines of bringing truthful information. It's all on today's International Edition. The number of Americans filing for unemployment benefits climbed past a staggering 30 million on Thursday, while Europe's economies have gone into an epic slide as well. As the U.S. economy continues this historic free fall, President Trump is pitching good times to come, while some laid-off workers worry about what's next. AP Washington correspondent Sagar Magani reports.
The president says the economy will roar back soon.
I feel it. I think sometimes what I feel is better than what I think.
In New York, what laid-off tour guide Ethan First feels is sadness.
I just want my job back.
He's getting jobless benefits. Without them,
I really don't know how I'll get by, how I'll be able to buy groceries.
Gabby Nam lost her job as a restaurant line cook and hasn't received any benefits yet.
I'll be able to make rent next month, but after that, if unemployment doesn't kick in, then I'm definitely in trouble.
Even as the economy slowly starts to recover, Bankrate.com's Mark Hamrick says people like First and Nam may be among those left behind.
Just how many of these workers will be called back to their jobs?
Sagar Magani, Washington.
Well, businesses around the world are reporting record losses. Unemployment numbers continue to be high as governments release stimulus packages to ease the financial blow, but the stock market has seen increases in recent days. To understand the economic situation and what may explain this, International Edition's Steve Miller spoke to David Wilcox, a senior non-resident fellow at the Peterson Institute for International Economics.
You know, people who claim to be able to interpret the markets with certainty must have a different set of powers than I do. I think it's a very confusing, mixed picture. The fundamentals of the health situation remain very serious. The virus is not yet controlled in the United States, and there's no assurance that it won't come back as some of the as states progressively reopen. We're going to be in a situation here with regard to how open the economy is, in a sort of situation of tiptoeing in and then running back, tiptoeing in and running back. And the running back will occur as the disease resurges. And then once it's under control, we'll tiptoe back in. I think what the markets are probably attempting to do is to balance all of that uncertainty on the health side with a massive amount of policy stimulus that's been provided to try to cushion the blow for those who are really seriously impacted by this situation.
If we take a look at the macro level of economics, the economy continues to move forward, slowly, but continues to move forward. Granted that each individual business is different and each sector is different. How good are things or how bad are things?
This is a eight-cylinder engine at the moment is not firing on several of its cylinders. It's a confusing picture where some companies are doing fine. Many companies that rely for their business model on human-to-human contact are nowhere to be found, and for good reason. For public health imperative, their workers, for their safety, need to stay at home. There's no percentage in bringing a company back when the conditions simply aren't safe. So, Steve, the picture ranges all the way from companies that are only mildly inconvenienced, where the workers may be needing to work remotely, to companies that have flatlined. just to take the simplest example, thousands of restaurants across the country, of course, remain shuttered, and there's not any prospect that customers are going to be eager to come back and populate those restaurants in anywhere near the way that they did pre-coronavirus.
The coronavirus outbreak has taken more lives in New York than any other state so far in the United States. New York City's health department is one of the best in the world, yet it was overwhelmed by the number of cases of COVID-19. Dr. Thomas Frieden, a former New York health commissioner, later the head of the CDC, and now the president of a global program based in New York, talked about it with VOA's Carol Pearson.
Dr. Tom Frieden is president of Resolve to Save Lives, a global nonprofit designed to take on silent killers like heart disease. But these days, he's putting his public health expertise to work to contain the coronavirus.
I was born in New York City. I was a medical student here at the height of the AIDS epidemic. I did my training in public health and in internal medicine here, also at the height of the AIDS epidemic in the 1980s. I started my professional career as an epidemic intelligence service officer here in New York City.
Dr. Frieden's New York City is a far cry from what the city looks like today in the midst of a coronavirus pandemic.
I'm a New Yorker, and I'm just heartbroken to know the number of healthcare workers infected, the number who've died, the number of people whose lives we've lost. Every day in the paper, we see just a tiny fraction of the number of obituaries.
Currently, there's only testing to see who has the virus. There's no treatment for it and no vaccine to protect against it. To save lives, Frieden says societies need to follow the lead of public health experts.
Public health can scale up its traditional tools of testing, isolation, contact tracing, and quarantine. If you get those four things right, you can box the virus in. And by boxing the virus in, you can reduce the number of cases, prevent clusters from bursting out into outbreaks and epidemics, and increase the space for all of us to return to society.
Yet the virus will still be out there, and Frieden says it will still be dangerous.
No one should underestimate how deadly this virus can be.
Even after the worst of this pandemic is over, people will still have to take precautions, because if they aren't careful, Frieden warns, the virus will come roaring back. Carol Pearson, VOA News, Washington.
California Governor Gavin Newsom is closing all beaches in Orange County, just outside of Los Angeles. Ed Donahue reports.
Newsom had wanted to close all beaches in California.
We're going to do a hard close in that part of the state, just in the Orange County area.
Last weekend, about 80,000 people were in Newport Beach and elsewhere. The governor says many were not practicing social distancing.
95 souls were lost in the last 24 hours. I hope that's a point of reminder and caution in terms of the behavior that we're seeing just a few of our beaches in the state.
Police say people in Newport Beach were keeping their distance. One lawmaker says the governor doesn't seem to get it. We need to trust the people. Beaches in Los Angeles County remain closed. I'm Ed Donahue.
Top African health officials say the continent has taken what appear to be effective measures in curbing the spread of coronavirus. While they note that lockdowns in some countries have had positive effects in slowing transmission, scientists say that the enduring economic and social harm of lockdowns could soon trump scientific considerations. Experts spoke to journalists the day before the continent's hotspot, South Africa, prepared to ease its restrictions. VOA's Anita Powell reports from Johannesburg.
Health officials across the continent have mostly succeeded in urging leaders to implement strict measures to combat the spread of coronavirus. And it may be no coincidence that the sub-Saharan African region continues to have the world's lowest caseload and the fewest number of deaths. But the crisis is far from over, says Dr. Matshidiso Moeti, World Health Organization Regional Director for Africa.
In terms of the situation in Africa, we are continuing to see an increase in cases. I think our outbreak is continuing. We are seeing case fatality rate in the region of about 3.9%. We have a couple of countries that have a higher case fatality rate. What is very encouraging, and I'd just like to emphasize this, is that we have a number of countries that have reported 0 cases over a couple of weeks. So these are admittedly relatively small countries, Namibia, Mauritania, and Seychelles. But they put in place as well some measures, early measures, starting with testing, contact tracing, which have produced some results. And then we are very concerned about West Africa, where we are seeing community spread in a significant number of countries compared to others.
In South Africa, the country with the continent's highest caseload, Health Minister Dr. Zweli Mkhize says a strict 35-day lockdown, which officially ends Friday, has made a difference.
We are actually seeing a slightly different trajectory that has pushed the peak of the epidemic to around September at the best case scenario, or maybe July in the worst case scenario. And this is going to be related to how we ease off the lockdown, so that the president has called for a risk-adjusted easing of the lockdown to take into account the food security issues, to take into account the economic recovery that needs to be supported.
Mkhize noted that the reopening will be slow and not drastically different from the current situation. The next lower stage will include a curfew, limits on outdoor exercise, and the obligatory use of face masks in public. Large gatherings remain banned, and many so-called non-essential businesses remain shuttered. Professor Kojo Ansah Koram, an epidemiologist in Accra, Ghana, says it's decisions like this that keep leaders up at night. How do they protect public health while also keeping other sectors of their country strong?
If you're in a place like Accra, where there's a large majority of people in the informal sector, for example, then that advice has to be weighed on, or has to be taken in addition to what will happen to that population, which probably have to go out on a daily basis to get their daily bread. And so you can make your pure scientific advice, but you have to be aware that it has to be managed in the context of all the other things.
As of April 29th, Africa had about 23,000 reported cases of COVID-19 and just over 900 deaths, fewer than any other region in the world. Anita Powell, VOA News, Johannesburg.
Here are some of the other stories we're following at VOA. U.S. intelligence agencies have concluded that the new coronavirus was not man-made or genetically modified, but say they are still examining whether the origins of the pandemic trace to contact with infected animals or an accident at a Chinese lab. President Donald Trump and his allies have touted the as-yet unproven theory that an infectious disease lab in Wuhan was the source of the pandemic. Japan is preparing to extend its state of emergency over the novel coronavirus for another month. It was originally set to end on May 6th. Prime Minister Shinzo Abe said even as some other countries begin to reopen after strict lockdowns, it would be too difficult to return to everyday life on May 7th, adding that the country needed to brace for a drawn-out battle. And Twitter says it will grant researchers and software developers access to a real-time data stream of tens of millions of daily public tweets about COVID-19, which they can use to study the spread of the disease or track information. Twitter said that this access could also be used by approved applicants working on crisis management, emergency response, or communication within communities, as well as those developing tools to help the scientific community understand COVID-19. Stay with VOA for all the latest.